High Cross United Reformed Church in Tottenham was the setting for a recent summit on the role of African faith leaders in HIV prevention. Coming just ahead of National HIV Testing Week, the conference focused on the incidence of HIV and AIDS amongst Black Africans in England. The event was organized by HIV Prevention England in association with the RAIN Trust, NAS Project London or NPL, Embrace UK, Positive East, Widows and Orphans International, the Metro Centre and the Africa Advocacy Foundation. Kicking off proceedings was the keynote speaker, Jabu Chawla, from the BHA and HIV Prevention England.
I think a lot of us know that HIV affects mainly populations that involve Black Africans or men who have sex with men. Okay? And there is a lot of data that you can read. Public Health England released that data a lot. But I thought for this conversation, because we are focusing on African communities, is that we share some findings from a recent survey that we did of Africans living in England.
Thank you very much on that point, and I move on to Mesty, who's going to lead us on just the basics on what is HIV and AIDS, just sort of basics before we move on. Mesty?
Many people when you go out, they don't know the difference between HIV and AIDS. So it is important to know for us, because if we confuse HIV with AIDS, I mean, still the perception is there that HIV is a death sentence. Once you get HIV, that's the end of it. Now there is a light means there is a promise, because people live longer. So we need to know actually the definition. What does that mean? So can anyone share us what HIV stands for? HIV.
Human immunodeficiency virus.
That's very good. Human immunodeficiency virus. So from this, we can understand that HIV affects only humans. HIV affects only humans. And the AIDS?
AIDS is when the viral load and the blood
AIDS, the
disease.
How does it stand? AIDS.
Is a hard immunodeficiency. Acquired immunodeficiency.
Acquired immunodeficiency syndrome. What it means is not inborn, it's not genetic. We get it after birth.
The conference highlighted the need for faith communities to work with the health sector to promote HIV prevention behaviors. These include condom use and the routine screening for the infection among their congregations. Akim Ogunyemi from Haringey Council noted that clergy preaching the use of condoms would be going against their grain, as they were more inclined to promote abstinence as a better method of prevention.
By the way, you should go and sign up for a condom scheme. You should go and get free condoms or access GUM for condoms. Kind of goes against the grain of what the theological teaching that they signed up to. What we said was, the reality is people do have sex outside of their religion. People have children outside of wedlock. So the message should be safer sex practice.
Christabel Kunda of the NAS Project in London touched on the phenomenon of denial by some African communities, which compounds the problem of HIV infection.
In our country, we don't need all this. We don't buy ARVs, so we're not infected, we're not affected. The people that buy the ARVs more are Ugandans, Kenyans, and what. So it's not something in our country we don't talk about. We don't even see them in the chemists selling HIV drugs and everything. So
the Reverend Fred Anin spoke about what he described as the ignorant use of scripture to explain away what is essentially a medical and not a spiritual issue.
We just use that one ignorantly. And then, some believe in spiritual things only. They believe every disease is rooted by sickness, by spirits, demons. So they interpret it according to what they think is the right thing, taking it root from the scriptures, which basically might not be a spiritual issue at all. And we all know that HIV is not a spiritual issue, it's a medical issue.
According to figures from BHA, the Health and Social Care Charity, up to 23% of the estimated 30,000 Africans living with HIV in the UK don't know they have the infection. This is where HIV testing comes in, the summit heard. Testing is vital as it can lead to early diagnosis, after which treatment and other prevention modalities can be deployed. Beatrice Nabulia, the speaker from Positive East, told the meeting that those carrying out the tests must be prepared to ask questions which may seem intrusive.
We discuss things like an individual's sexual history. I always tell people that I'm going to ask you some very personal questions about your sexual life, not because I'm being nosy, but because it helps me to validate the result when it comes out. If somebody hasn't been able to give you what they've been up to, it's very hard for you to know. The main reason we do that is about the window period. How many of us understand the window period? When HIV gets into the body, it takes 12 weeks before it shows. If somebody had unprotected sex last night and they came here today to do the test, it means that I will do the test today, but then I'm going to count 12 weeks and then request them to come back for another test.
Chinelo Nwajiobi of Enfield Council said she was happy people in the faith communities were now talking openly about HIV and AIDS.
I think what we'll do is to engage faith leaders better. We're already doing that in Enfield, but I think learning that other places are doing it, particularly having the results of the survey, I found that very interesting. And the learning from that, I can take back the resource that faith leaders provided around using the scriptures or using the Quran to say that it's okay to talk about HIV and it's okay to talk about these things.
On the issue of faith leaders' disapproval of condom use, I spoke with Bishop Eric Intori-Kansa of the Live in Flame Baptist Church, who put it down to what he described as a lack of knowledge.
I think it's also due to lack of knowledge again, because people grow in their faith. Whilst they are growing in the understanding of their faith, they might sometimes fall, and the grace of God help them to get up. So when they are falling, if they go for their condoms, there's nothing wrong with it, to preserve their life so that they can keep on growing. When they grow to a level where they will not fall, they will not even think about the condom. So it's unfortunate again, because in the faith we are not the same. It's just like in school, some are in class 1, class 2, class 3, others are doing their masters.
The bishop was definitely singing from the same hymn sheet as the conference organizers. Much later, as I embarked on my journey home, I could not help but reflect that the organizers will be praying that more faith leaders will join in the chorus.